Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. Recently, I had the same question come up a couple of times about NuSmile Signature or pre-veneered crowns. The question is, if part or all of the facing of a pre-veneered crown chips off, can I repair it? The answer is both yes and no. You can repair a small chip, but most of the time it's faster, easier, and more aesthetic to simply cut off the old crown and replace it with a new one. First, let me say that according to one retrospective study, the likelihood of chipping or wear of the facing is probably around 15%, and rarely does this involve the entire facing. From both that study and personal experience, I'll tell you that maxillary canines are the teeth most likely to show wear or chipping of the veneer. Now, I want to recognize that it's always frustrating when something that we do doesn't last forever. But we've all had Class II composites or amalgams fracture or fail, and we've all had pulpotomies fail. And unfortunately, we'll occasionally have a facing on a pre-veneered crown that will chip or break. So, as I said earlier, usually the easiest fix for this is to remove the old crown and re-cement a new one. Hopefully, you recorded the crown size when you originally placed it. When I do this, I usually just charge a re-cement fee, and I don't charge the patient for a new crown. You might ask, but can't I fix even a small chip? Well, yes you can, but you can't do it by simply putting bonding agent onto the metal and the remaining composite and expect the repair to stay. If you're going to repair a small chip, you can do a small open face repair. This involves using a 330 burr to cut through the stainless steel in the area of the fracture and then filling in the cutout area with composite. When you cut through the stainless steel, be sure to put some small undercuts under the remaining stainless steel to lock your composite into place. Also, I found that it's important to use some kind of an opaquer under the composite due to the difference in the translucency of composite that's over to structure versus the translucency of the remaining composite facing that is over the stainless steel. After placing the opaquer, use the lightest shade of composite you have because the facings are very light. Now, after composite placement, sometimes I've used a white opaque sealant as a top coating to blend the composite of the repair to the facing. As I mentioned at the beginning, this is best for fairly small veneer fractures. Ultimately, replacing the crown completely will probably lead to a more favorable result. And a final thought. When veneers fracture within a few weeks or months of placement, there's a good likelihood that the operator forced the crown onto the prep, and that created microfractures in either the facing or the bonding of the facing to the stainless steel. If the veneer fractures a year or later after placement, I would guess that some trauma in the recent past was probably a precipitating factor. I hope you find this helpful, and I hope that your repairs and replacements are very few. Thanks for watching. I'll see you next time.